Have you ever been prescribed tramadol or tapentadol? So what are those pain medications and how are they different than other opioids like hydrocodone or oxycodone? Tramadol or Ultram and tapentadol or Nucynta are unique opioids because not only do they bind to the opioid receptor, which is how most opioids work, but they also increase serotonin and norepinephrine. So how does that help with pain? Your body uses serotonin and norepinephrine to control pain signals. So by changing the amount of serotonin or norepinephrine in the brain, it can affect how your body experiences pain. Tramadol is about 10 times less potent than morphine. So 10 milligrams of morphine equals 100 milligrams of tramadol versus tapentadol is about 3 or 4 times less potent as morphine. So 40 milligrams of morphine equals 100 milligrams of tapentadol. So when might these medications be more helpful? So if you haven't really responded well to typical opioids like hydrocodone or oxycodone or morphine, these medications might be a better choice. Sometimes these medications can be more helpful in nerve-related or neuropathic pain because they do cause those changes in serotonin and norepinephrine. So what are some special considerations if you're thinking about starting these medications or you've talked about them with your doctor? The first one is serotonin syndrome. This is especially important with tramadol. So what is serotonin syndrome? When your body gets too much serotonin, it can cause some pretty wacky stuff. So the first thing can start with sweating. You can feel like you have a fever, and then it can turn into things like feeling really jittery, confused, a little agitated, and then you can start getting rigidity in your muscles. That means your muscles feel really tight. It can eventually progress on to things like seizures or even irregular heart rhythms. So that's pretty serious, so definitely something to watch out for. We worry about it the most if you're on other medications that increase serotonin, like SSRIs, or if you are on a really high dose of tramadol. So the other consideration is if you have a history of seizures. So both Nucynta and tramadol can increase the risk of having a seizure, especially if you have a history of seizures in the past. I hope this helps explain a little bit more about these medications, why they're pretty unique, why we would or wouldn't consider using them in patients.